Hi, everyone. Can you all hear me? If anyone can nod their head if they can hear me. All right, good. Awesome. Thank you. Thanks for joining. Like I've said in the past, we're trying to do these a little bit more regularly now, clearly because the cases continue to rise and are increasingly concerning to us. So since the beginning of the pandemic, we now have 3,780 COVID positive cases in New Haven and 117 fatalities. One thing to note for folks that have been following this closely is that last week, that number that I just shared did not include Docs Urgent Care, which has facilities in North Haven, Hampton, West Haven, and East Haven, in Orange. This number that I just shared now has that information. So it's more accurate in assessment of our overall situation. And as folks know, we are in the red, like many other communities in Connecticut now. I wanted to highlight that we've had a number of cases of city employees testing positive. And I'm just going to go through a list. Folks are probably familiar with the city clerk's office that had one employee that tested positive. And there are 12 individuals self-monitoring that were that had some exposure to that person. LCI's had one individual, and there's 7 self-isolating. CSA has had 1 positive. DPW has had, Department of Public Works has had 1 positive individual, 2 self-isolating. Tax office had 1 individual with 0 self-isolating. Police department has 1 individual, and there are 15 officers out currently because of a variety of different potential exposure situations. Fire department has 4 positive and 21 self-quarantining. And Dr. Vasquez, do you have numbers on New Haven Public Schools? Not to put you on the spot.
I do indeed. I was just pulling that up. So for New Haven Public Schools, we currently have 14 staff members who have tested positive, 12 students who have tested positive. There are 19 staff members who are presently self-quarantining and 41 students currently self-quarantining.
Paul Bass is going to ask a follow-up question later on about that because he looks like he has one in his mind. Obviously, we're working very hard to reduce the potential exposure to city employees and working to have employees self-screen when they come into work. And this is, I think, also an indication just of a overall community-wide spread, which is impacting all over the community. I wanted to take a moment to share the screen, and I'm going to share the screen without talking so that the interpreter can be seen when I talk about the details on the screen. But this is the number of cases in MAP that we've shared in the past. So I'll just share that right now as an update. Number of citywide positive cases. Hospitalizations. And fatalities, the breakdown. And one thing to note, there's a slightly increased percentage of the positive cases citywide that is unknown as far as race and ethnicity. We're working to push our testing partners to make sure that they're identifying that information and providing that to us. As folks will remember, at the beginning of the pandemic, we were not capturing that information as thoroughly as we would have liked because the testing partners weren't asking that information. But I think because we got an uptick, we need to work with our partners, some new and some that have been doing this for a long time, to make sure that we're capturing that information. I'm going to hand it over to Director Bond to see if she has any updates.
Good afternoon. Thank you, Mayor. We continue to conduct monitoring of surveillance among colleges as well. And so to date, between August 1st and November 6th, we have seen 108 positive cases reported of students and 57 of faculty and staff. On a weekly basis, they are averaging over 7,500 unique students and staff being tested on a weekly basis, which is really great to see. We currently, for the week of October 31st through November 6th, have 36 students that tested positive and 12 staff. We are seeing an increase of clusters in residential colleges at the University of Yale. They have changed their internal campus status to orange. We work closely with their point of contacts in regards to contact tracing and support. And so that is going very well. At Southern Connecticut State University, we have 15 positive students and 2 staff, of which 59 students, in addition, 59 commuter students and 4 additional staff who self-reported for the week of, between the week of August 16th through November 30th. They average about 3,600 students being tested on a weekly throughout the duration of August 16th through November 3rd. And currently to date, we have 3 students who tested positive. In addition, 5 commuters and 1 staff. So that's a total of 9 for the period of November 1st through the 3rd. We have no issues in regards to sports at this juncture with this particular university. Albertus has 28 positive students and 3 staff between the time frame of August 18th through the 5th of November, and no clusters being reported at Albertus. Gateway Community College have about 11 contacts self-quarantining at Gateway Daycare out of an abundance of caution due to a student observer interacting with children and some staff. Our nursing homes, we continue to closely work with nursing homes. As I previously reported, they are now testing weekly. There were no new reported cases of residents by the nursing homes. We do have a few staff that did test positive between the week of October 18th through November 3rd, and we continue to work closely with each of the nursing home centers, and that includes Advanced Nursing, Grimes, and Leeway. Other notable items that, as the mayor mentioned, we are working closely with inter-departments within the city government to ensure that all protocols are being followed, in addition to other sector violations and follow-up. Currently reviewing corrective action plans for each of those respective sectors. And we continue to work closely with Regal Care on getting in compliance with their deficiencies that were found within their facility. And with that, I'll turn it back over to the mayor.
Thanks, Director Bond. And if I could turn it over to Dr. Vasquez just to talk about the work that we're doing to facilitate testing around the city.
Absolutely. Thank you, Mayor. So as Director Bond and Mayor Elicker mentioned, we do continue to work on expanding testing throughout the city. We have several test sites which are open on a weekly basis, and we are working to expand pop-up testing as well. On a weekly basis, we have 2 sites offered by Yale New Haven Health, as well as a pop-up site by Yale New Haven Health. We have Fairhaven Community Health Center, Cornell Scott Hill Health Center, and then this week on Sunday, we also have a pop-up testing site which will be held at Columbus School. I can share my, I don't have screen sharing privileges, sorry. We do have a map on our website. If you go to our COVID-19 hub, it's covid19.newhavenct.gov. And if you click on testing locations, you can pull up a map as well as a list of all the test site locations. So this is a view of the map. If you click on any of the sites, it will highlight that information for you with which partner is offering that testing, what days the site operates, their website and phone number, the address of the test site, as well as any other information you may need to know. So this will tell you if you need an appointment, if walk-ins are accepted, etc. And this is updated as needed. With the pop-up testing sites, we update the dates. So please check carefully at the top of the boxes, and it will tell you what dates those pop-up test sites are being offered. And again, you can also call our COVID-19 hotline at 203-946-4949 for assistance finding a test site location.
Thanks, Dr. Vasquez. And just given the screen sharing, people can't see the interpreter. I think that most of the things about how to use the website are self-evident, but if people do not have access to the internet, they can call 203-946-4949, which is the health department hotline, to get more information on testing sites. I think that's it from our team. Is there anything else that I missed from folks?
I did want to maybe briefly mention our mass vaccination planning efforts.
That'd be great.
If that's okay. So we're just going to screen share really quickly. So the health department are actively working on preparing for our COVID-19 vaccine efforts. And I know that question was raised several times. And so I thought it would be prudent of me to just be able to share our efforts. And so currently, the New Haven Health Department have created a mass vaccination planning committee that consists of utilizing guidance that were issued by the Department of Public Health and the Center for Disease Control. And we have representatives currently from the New Haven Fire Department, Police Department, Department of Disability Services, Office of Emergency Management, and our Chief Administrator's Office. And we're also working in conjunction with, not locally, but also our regional partners to ensure that we are going to be ready for point of dispensing vaccines. And so our first phase of anticipated potential supplies of vaccines will be in the following phases. The first phase will be focusing on critical workforce groups, including but not limited to police, fire, EMS. It may also include some essential employees, as well as schools within the district. Our second phase of implementation will be larger vaccine doses available, and will be including local community partners. And then we will transition into the third phase, given that there are sufficient supplies, to do mass population vaccination. And so we are working closely with our committee and regional partners to ensure that we are inclusive, and then also ensuring that we have the proper locations to conduct our vaccine administration. That concludes my update.
Thank you, Director Bond. And Dr. Tracy has joined us as well. Dr. Tracy, do you have anything that you would like to share? You're on mute. There you are.
Can you hear me now?
Yes, we can.
Okay, let me say good evening to everyone. And I just want to report that we have been informed about possible cyber attack on primarily one of our schools right now. We're working to see how far-reaching this is right now, where someone is hacking into students' Google accounts, and sending inappropriate messages to other students and parents and teachers. And so we are working with the police department and the FBI and our own IT department, in collaboration with the mayor's IT department, to see how to what extent or how far spread this is, and whether it's not, it's impacting other schools. We are going to work with our principals to share with us any information they're getting from their end. But right now, this is under investigation about what is happening. And I have already sent information out to our parents and to our board regarding this.
Thank you, Dr. Tracy, for sharing that. Do folks have any questions? Go ahead, Paul.
Should I start with just asking one so other folks get a chance?
Sure. Usually Tom asks 3, and then someone else asks 1, and then Tom asks 3, and then someone else asks 1. So you can go.
Okay, I only have 4. Okay. Director Bond, it's so nice to see everybody, even if it's virtual. When Yale went into the partial lockdown at some of its colleges, it said that its students were catching them from social events and restaurants. I was a little curious about that. Are there specific restaurants to which outbreaks have been traced? And does that raise any question about whether it's safe to eat indoors or even outdoors?
So that's a few questions in one.
Oh,
So
well.
I'll start. I'll start with. So you have a combination question. So I'll start with the first in regards to the investigation. The investigation that began with the number of students that have tested positive were linked to visiting a restaurant and shortly after tested positive. We did immediately conduct an inspection. Ironically, we had been there already with their routine inspection and had given them some minor corrective actions that were not related to imminent risk, but just more routine management of the establishment for food. We then worked closely with our epidemiologists and our sanitarians to follow up with the potential link. And they have a small base of employees of 2 who have a second job and routinely get tested anyway, and we're able to produce those results. Out of the abundance of precaution, the other 2 are being tested. And then we also had the establishment disinfected to ensure that that was not a linkage of other potential individuals getting impacted. As you know, the Department of Public Health did issue a report indicating that restaurants, based on contact tracing reports, that restaurants have been generally linked at statewide. And so we continue to closely monitor that. We are ensuring that indoor dining adhere to the phase 2.1 protocols. We have our sanitarians that go out on a routinely basis. We encourage residents that may have any concerns to certainly call us at the hotline, 203-946-4949, or C-Click-Fix, where they can actually take a picture or upload a video onto a C-Click-Fix if they download that into their smartphones. So certainly we have followed up with that and continue to work with both the sectors, which is the restaurants, and our college community in mitigating any cases that
Thank
we
you.
come across.
Which restaurant, how many kids, and how do we know they got it at the restaurant as opposed to somewhere else?
Exactly. There is no direct linkage at this juncture that they actually were exposed at the restaurant. The restaurant in question is Amigo Felix, which is on Willie Avenue, and they have complied and have done and followed all the health and safety measures. And we have no concerns at this juncture with that particular
Why would Yale
restaurant.
say it was a restaurant?
And
Why would Yale
I'm sorry?
report that they got it at a restaurant?
I'm not certain, but I haven't read that article. There were a total of 6 potential students that were linked to have recently visited that restaurant.
Thank you. Justin, should I hold off on my others since other folks might have questions?
Let's go to Dave, and then we'll come back to you.
Thanks, Mayor. In regards to what Yale is telling students right now, they're telling them not to leave campus, to try to stay there, to not go to restaurants. One, do you agree with what they're asking students to do? And also, should any of the other colleges in the area be doing the same? I mean, you listed a number of universities with cases.
Yeah, Dave, that's a good question. I think in general, the general population really, we as the mayor mentioned, we are in the red alert zone. And the governor has issued a notice that we really need to be limiting travels to necessary travel. So if the universities are asking the students to hold back and to stay on campus, is a wise decision. We are seeing an increase in positive cases among that age group, 18 to 24-year-olds, although the 25 to 49-year-olds continue to be our highest percentage of contracting COVID-19. We know that there's a lot of social gatherings that are happening within that age group. So we want to send a message to the public in general, follow precautions. We are in the red alert, wear your mask correctly, watch your distance, because this cumulative time of 15 minutes encountering with someone, even if you have on a mask, poses a risk if you have less than 6 feet proximity with that individual. And so we want to be just very vigilant and as a community as a whole.
Thanks, Dave. Anyone else before we go back to Paul? Go ahead, Paul.
And let me know if I'm asking too many, and I'll go to people privately after.
Wow, we missed you.
I missed you guys too. Dr. Tracy, which school was it today we discovered this? And is this related to online learning? Was it people learning remotely who got punked?
Yeah, so the school in question, Paul, thank you and welcome back. I've missed you too. Columbus Family Academy, particular, and we've heard of a couple of other places where it seems to be spreading, but not to the extent as Columbus right now. And yes, it's related to students using Google Classroom to access online learning.
Good
So
luck on that.
there's a breach or somewhere. Yeah.
So it appears that it's a student that is using an email address, or it's a student's email address that it's used. So while I think the assessment is it's not directly related to online learning because so many students are using the online platform now. It's just, students, and Dr. Tracy, correct me if I'm wrong, students have access to these emails even when in normal times, but since students are using the platform a lot now, that they're just more likely to be using the emails as well. Is that correct, Dr. Tracy?
Yes, to a certain extent, yeah.
So I'm totally confused. Was this during learning that this stuff popped up?
During learning, some of them during learning, some of them emails are being sent to not only students, but parents and teachers. So someone has access to some email account and is using that to send this information.
Thank you. Justin, you talked about protocols for city workers. What does that mean specifically? Is everyone getting the temperature taken when they come? Do they fill out a sheet answering questions about the last 24 hours? What is the exact protocol and how widespread?
Director Bond, do you want me to take a stab at it, or do you want to go for it?
I'll go for it. So we, as a city, worked very hard in conjunction with the HR department to develop protocols that are standardized across the city to ensure that we are following the necessary and taking the necessary measures. And so that does include pre-screening forms and temperature checks, and as well as ensuring workplace safety sector rules that the governor issued. And so there was definitely a committee that worked on that early on. I cannot take any credit for it. I merely give guidance, and then a lot of the different departments came together to ensure that there's plexiglass where it needed to be, that the disinfecting areas were increased and things of that nature. So we have certainly taken precautions to ensure things are in place.
Unless I misunderstood, I got the sense that because of these cases that have popped up in recent weeks, I thought, unless I'm mistaken, that Justin was saying something's happening with new when people come in, or did I just misunderstand that, like temperature checks and stuff?
I'm not, you're talking about a different policy or what?
Did something new happen last week or two after these cases developed that you're doing differently with employees?
No, no, we're not doing anything new. However, we're concerned about the number of cases. And I think that we can't sugarcoat things in that with a large organization that has many different departments that have, each department has different attributes about how people interact. We're working to make sure that every department is holding employees accountable, providing the infrastructure needed. And so, you know, as an example, Public Works has people that are traveling in the same vehicle together, picking up trash. Police department and fire department has people that are living in the fire stations. And the police department used to go out with 2 officers in a vehicle a lot of the times. No, they no longer do. And so we're evaluating more deeply what each department is doing to make sure that we reduce the number of people that are likely to get exposed if we have a positive case.
Thank you. I had one more, unless other people do, or if it's.
I just
Can
want
we
to
go-
add,
Go ahead.
I think as a quality assurance method, our task force will be assessing workplace implementation of the protocol. So, you know, you can have a protocol in place, but we want to make sure that we have that dusted off and is a live document and not just a protocol that checks off a checkbox. So, to the mayor's comment, is quality assurance for us is very critical, and we want to make sure that we reduce the risk of exposure as much as possible.
Yeah, just to be direct, just like there's some businesses in the city that sometimes don't always follow the rules exactly, we want to make sure that every department is following the rules exactly as well to keep everyone safe. We owe it to the city employees. Can we go to Thomas and then come back to you, Paul?
Thank you. So in the data you shared, it showed when you see statistics like close to 80% of hospitalizations in the city being from people of color, how are sort of how is that data factoring into the policies that you're and protocols you're thinking of now as rates are increasing?
I mean, I'll take a first stab at that, and then if Director Bond, you want to add something, you know, this has been a trend throughout the entire nation, and New Haven is no different, and it's underscoring the inequities that exist in the healthcare system and the economic system that are closely tied to race and ethnicity. I think that our team has worked hard to provide resources to communities of color, and that's everything in New Haven. And that's everything from the basic needs, like food, for example, but particular to COVID, making sure that people have access to testing to identify within the neighborhoods. We've done a lot of pop-up testing sites within the neighborhoods. I went by Columbus School yesterday, and the line was around the block for testing. And I think we've talked about this a lot today, need to continue expanding access to testing in communities to make it very, very easy for people to get tested at times when they're not working. So providing more options for weekend and evening testing as well. And I know that that's very important to our team because not only is it the right thing to do, but it helps us get the virus under control. I don't know if Director Bond, you have anything to add there?
Yeah, I do. You know, the mayor brings up 2 great examples: is access to testing and then ensuring basic needs are being provided. For us, as a city health department, we always are conscious about implementing everything with a health equity lens. We know that this is disproportionately affecting communities of color at a higher rate, but we also know that we don't have a full picture of the data. My data today is telling me that 40% is unknown, and that's not acceptable. As we are issuing tests in our city, we have to do a better job in knowing the race and ethnic background of those individuals so that we can know and get a better picture of who is all being affected by this pandemic. But given the picture that we do know, we want to then also partner with community influencers and also be able to relay the message so that it's getting on multiple levels. And we work really hard with that factor and getting on media outlets, as well as supporting faith leaders from every place of worship you can imagine, so that we can be able to provide as much education, awareness, and as the mayor mentioned, access. And so I do want to challenge our stakeholders that provide services to our community to be thinking about, look at a Sunday testing site and the impact that had, that we had so many people that came out. Imagine if we expanded ongoing services at times that are feasible for the community and not vice versa.
I want to highlight something that I think is important that I forgot to mention that Director Bond reminded me of. So what I showed was an aggregate over the last 8 months of the pandemic, the numbers. What Director Bond is talking about is in the last 2 weeks. And I'll share with you the breakdown of race and ethnicity over the last 2 weeks now. So you can see that there's 40% unknown. So we have a pretty significant percentage of the testing that's being done where they're not asking people their race or ethnicity. And also you can see that a much larger percentage of the Latinx population is positive right now. And that's something that we are working to understand. And so just Thomas, another component is this morning on our COVID meeting, we discussed a Spanish language media to make sure that we're accessing or making all of the information of testing and other resources available to the Spanish speaking community.
Thank you.
Any other questions? Let's go Paul and then Dave.
Or I could defer.
Go ahead, Dave. Go ahead, Dave.
All right, thank you, guys. The big part of the governor's press conference today is about Pfizer and their vaccine breakthrough. I know you talked a bit about, Ms. Bond, about the breakthrough, well, about your phases that you're talking about. How soon do you think maybe phase 1 of vaccines could start?
If the emergency order gets passed, it's going to be late November or shortly thereafter. So, it's evolving as quickly as the news gets reported. So we are definitely preparing and gearing up. Dr. Vasquez will be leading that effort with us, and so along with our nurses. But yeah, so they are trying to get an emergency approval for the end of November. So we'll see. And as soon as we find out, we'll let the media know.
In terms of people who may be high risk, what phase would they fall into? I know there's essential workers, but then where would high risk, like nursing homes, be involved in that?
So the nursing homes, for example, will be a specific charge of a sector. So local health, hospitals, community health centers, we will all be given a charge and prioritized by phases as well. And so I am certain that they are definitely being prioritized. What I presented today is what the health department will be prioritized to do.
Thank you.
You're welcome.
Thanks, Dave. Go ahead, Paul.
It's a quick question, thanks. 41 students you said are self-quarantining in the public schools. I didn't think there were even that many students in the public schools. Are there kids in the schools and are they all getting COVID?
Dr. Vasquez, you're including schools. There's some schools that are still somewhat in session.
Yes, so there's some schools somewhat in session. Some of those numbers do reflect students who are learning remotely as well. So not physically in the schools.
So Paul, just to be clear, there's charter schools as well that are included in our numbers. And
Are all the in-person
autonomy they have some autonomy to make this decision about open or remote.
So charter schools are still open, hybrid, and that's where most of these cases are from?
Well, it depends on the charter school.
All right, thanks.
Yep. Anything else? All right, good to see everybody. Take care.